like an MLA or a minister, they have a very bad opinion about a private hospital. They feel always that when a private hospital opens, it is like a business venture. At the same time, private hospitals are considered non-ethical and exploitative. That health, education, and food should be free, should not be a burden on society. We should remember that 70% of OPD clinics are run by private uh, doctors in India. National Health Services in United Kingdom. So it was considered as a global model for healthcare. We thought it's given free health, very good. But now it's collapsing. Now when I'm seeing 15 years down the line, there are so much regulations. So rules should not hurt the right people. Where they in the NABH manual only they call patient a client or a customer. In America, after heart and cancer, first cancer, second heart. The third most common cause for death is iatrogenic. That is called medical errors. We are actually losing good doctors, not because they are failed medically, because they are unable to survive in this atmosphere. So everything that is free is not good. Unless the outcome is good, giving free has no returns at all. In hospital, we see how many MBBS we want, you produce. Then you see what is the size of an ultrasound room. You are interested in that, whether it is 20 by 20, whether there is a handicap toilet. All this you see. NABH accreditation do you have? The YSFT accreditation, all input you see. You are least bothered on how many patients are coming out alive. Sometimes the central government or a Supreme Court judge, he will pass a rule saying that this applies to whole of India. It's not that easy. Sometimes I see in paper, this hospital chain has 10,000 beds. What you are talking? India's population is 1.4 billion. What will you do with 10,000 beds? It will not touch anybody. What can you do with 2,000 crores, one hospital in the capital of the state? You expect the whole cancer patients to go there and sleep on corridors? Namaskar and welcome to MIO Podcast. I am Dr. Suresh Rao. I am Director of Mangalore Institute of Oncology, and I am working in the field of oncology for the last 3 decades. Today we have a very tough topic, and I am speaking to you as a ordinary citizen of India, not as a senior oncologist nor a director. So I have been experiencing our as a doctor and as a person running an hospital, a private hospital, in an urban place like Mangalore, plus also in a rural place like Tirthali. We have 3 centers actually. One at Mangalore, one small daycare unit in Udupi, and one in Tirthali. So now there is always debate on health. Wherever I go for a talk, there is a debate on health. So we are at crossroads actually. One is the government setup and one is the private setup. Wherever I go, the public representatives, like an MLA or a minister, they have a very bad opinion about a private hospital. They feel always that when a private hospital opens, it is like a business venture. So this is their general opinion. But generally, people at big positions never take treatment in a government hospital. They always go to private hospital. So there is some what they say and what they want to do. Their ideals are noble, but it doesn't work that way. At the same time, private hospitals are considered non-ethical and exploitative. So this balance is there. Government hospitals are free, but there are some faults. Private hospitals are expensive and maybe exploitative in many occasions, but there are some faults. So there are good people everywhere. We have to draw a balance. So this is the debate today on healthcare in India. How should we progress forward? Because we are at a very crucial juncture. Because whether I am a doctor or whether you are a policymaker, whether you are a normal citizen, the health of the nation affects all of you. So someday we may get some illness, and at that time, all these factors matter a lot. So we have to see how we go forward. So let us discuss on this, and I will discuss it in a few topics. So each segment there's a different way that we can probably try to find certain middle ground to this problem. Now let us discuss actually how much it costs to give good care. So let us talk about data, because rhetoric is different. We can speak anything in the air. So we should talk about data which is available in the government audit reports. All this we'll know exactly what it costs actually for a healthcare system. So generally, say in a government hospital, say district hospital, for a general ward bed, it will cost to the government around 1,200 to 2,000 rupees to manage one bed. So manage a bed means it includes a major component is staff salary, like doctors and all the staff salary, then electricity bill, then small consumables, maintenance. All these things comes into the picture. So it is around 1,200 to 2,000 rupees per bed in a district hospital. Same thing if it is a tertiary care hospital in government. Say you can take example of AIMS. Their own audit reports will tell you that it may cost around 2,500 to 4,000, because there the number of doctors are more, there are super specialists, their salary is higher, there's research wing. So all that cost when you calculate, it costs around 2,500 to 4,000 in a tertiary care center in government setup for a general ward bed. You come to the private sector. Private sector generally in a corporate hospital, I'm telling not in teaching hospitals, I'm telling in corporate hospitals and other private hospitals. Corporate hospitals in general ward, so you go to Mumbai or Bangalore, big cities anywhere in India, Delhi for that matter. So it will cost you anywhere between 4,000 to 7,500 for a general ward. This is just bed charges and nursing charges, etc. So other charges, lab and all those things. Finally, you end up paying at least 10,000 rupees a day for general ward in a corporate big hospital. Say you have a 500 bed hospital, they have a lot of overheads, a marketing team, so much cost will be there. So that is the, so we have brought a balance, and we started a hospital in Tirthali. So we are charging 500 rupees in a general ward, and I feel that still we are able to manage reasonably well. There is no major consequences. It may take time for us to pay the bank loan and extra, but I feel that even with 500 rupees a day for general ward, we are able to manage. So this shows that there is something wrong going on, and with quality remaining the same. So we should focus on outcome. So what treatment I give at a rural cancer hospital in Tirthali, I am 110% sure that the outcome will be same anywhere in India or anywhere in the world for that matter. So if I do a surgery for breast cancer, what is the outcome? You can measure it. So, but I am doing it only at 500. MIO is doing it actually with my colleagues and friends. We are managing in that way. So we have to draw a balance so that we get good and efficient setups. The rural hospital in Tirthali, what we have, it has all the facilities. Like it has a very good ambience, very well done hospital, well lit, and it has nice consultation OPDs, spacious. It has ICU, it has post-op wards, it has operation theaters. Quality wise, it is very good. So treatment wise, doctors are very senior. Only more than 15 years experience doctors are permitted to operate there. So all of this is happening as a team. We are doing it, and this hospital is able to manage with 500 rupees a day in a general ward bed. So this is my personal experience. I brought this topic because it is a very big challenge for hospitals like MIO uh, who are running ethical services. I'm not trying to find fault with anybody else, but to manage in this system. So most of the ethical hospitals may ultimately have to shut down or drown in this environment. So we have to discuss this so that those who make policies, citizens, all of us should speak about this. Now let's discuss what is wrong with the systems, both the systems. Let's be fair and be honest. So both systems have deficiencies, so that we must agree at first. Not both are perfect. That's why we are landing up in this problem. So the government healthcare system is built on very noble ideals. So in India, the general principle of historically is that health, education, and food should be free, should not be a burden on society. So you should get free healthcare, free basic education, free nutrition. This is the noble ideals of the government. So on that principle only, they try to give free food, all this free education. Now the thing is, how is it running? So actually, in government setup, the doctors are very good doctors. Actually, the I can say the cream of doctors who give exams through meritocracy. They somehow land up in government. They are very good doctors. Actually, you could discuss with any government doctor, you know the enormity of work he's doing. You meet a DHO, you meet a THO. So huge work they have done. We should remember that 70% of OPD clinics are run by private uh, doctors in India. But government does the major, what you call, bulk of work in tuberculosis, infectious diseases, malaria, dengue, so many things. The government doctors work very hard. But somehow, why it is not efficient? It is overburdened, it is saturated, it is fatigued. Uh, there are faults in efficiency and management of resources. So basically, we have to encourage good doctors in government hospitals. Suppose a DHO, suppose you can take Mangalore for example. It does very good work, tuberculosis control. You have to straight away lift him and put him as an advisor for Karnataka government on health. He'll save you thousands of crores. You can give him 5 times his salary, but government should work like this. Good people have to be encouraged. There are in government lot of good doctors. So if you don't encourage them, then somewhere they get frustrated and they will go with the system. There's job security may be there, all this will be there. But their true potential, which I feel is very great of government doctors, is somehow not utilized properly. So we have this bad habit. If one person does some mistake, you punish everybody. You transfer all the doctors, you all transfer all these people. So one person has done mistake. There are problematic people in every society and every profession. So you cannot blame everybody for the fault of few. 2, 3 people do mistake, you can't blame the other 7 or 8 people. So this is happening. See, the classic example is of NHS in UK, National Health Services in United Kingdom. So it was considered as a global model for healthcare. We thought it's given free health, very good. But now it's collapsing. It's collapsing because they are unable to manage staff, the efficiency. So they have to wait for CT scan 3 months, for dental appointment 6 months, for cancer biopsy report for 4 months. So it has become so inefficient. Ultimately, the healthcare will suffer. So in UK, you can't get your CT scan done, call somebody and get it done in 1 week. You have to wait for 3 months. In India also it is like that. Suppose in AIMS, can you get your CT scan or MRI done in 1 week? You can't. Only unless you know some person in high position, you can done in 1 week. But ordinary person like me and you, if we go there, they will tell you to come after 3 months or so. I think so. So this is the problem. The system should be run efficiently. Cost considerations has to be seen. The money has to be put in the right places. So the government has one is very good doctors are there. It's not that there are no good doctors there. They are very good. But the problem is with the system. So you are not utilizing it in a proper way. Recently, an MLA told me in Tirthalli. So he told me that he has done the hospital fully, spent 10 crores and done a very good hospital. But the staff has not been appointed for 6 months and it is lock and key. So 10 crores you are spending and you are keeping the hospital under lock and key for 6 months without appointment. Will I ever do it if it is my money? No, I'll never do it. Because for me here, even 1 crore, if I keep for 1 month in bank, I will get 70,000 interest. I will think like that. Otherwise, if I don't do anything, I'll lose that money. So it's like my money. So when it is in government, unfortunately, these things are, nobody is held accountable for this. Now you open a hospital and not appoint for 6 months. Who is responsible for that 10 crores investment and loss for 6 months? So that is the issue with government. Same thing, suppose you take private hospitals. It is efficient. If you see any big private hospital, as soon as you go, there will be a front desk executive. She will tell or he will tell, good morning, sir. They will stand up. They will welcome you. They will see that your waiting time is minimum. They will treat you like a VIP. As the hospital becomes bigger and bigger and more costlier, these services will be more and more better for you. So they'll make you feel happy. everything, and then they will see that you are comfortable. But all this comes at a cost. It's not free. So for all this, you will be charged. And sometimes what happens, unethical practices creep in. So it's like in a shop, you go to buy sari. My wife goes to buy sari in Mysore silks. So she goes and buys sari. Now she is in her mind bound to buy 10,000 sari. But when she goes there, she'll buy 50,000 sari or 30,000 sari, because that person there will tell, Madam, this is good. She'll take around 10 sari. She'll make her feel happy. She'll tell, this looks good on you. All that happens in a shop, and you end up spending more. Same thing now in big corporate hospitals. There are people who will tell you what is good, what is that. And generally, basically, sometimes unethically, they will sell investigation to you. They'll sell second opinions to you. Basically, it becomes unethical practices. Actually, may not be required. Some may be required. I'm not telling all are doing it, but when you tell that you are spending 20,000, 50,000 rupees for a illness which is not required, then you're overspending. So this is the problem. And the problem is, once one hospital does that, you bunch everybody in one. So private hospitals, all are bad. This is the general opinion. When you speak to any public representative, they will tell you the this all private hospitals are like business centers. So we should remember that there are good people in government and good people in private, whether it is doctors or paramedical staff, administrators. Lot of people, good people are there. So we have to see how to make it more efficient, so that everybody has a role to play, but it has to be accountable and should be efficient. So this is the most important thing, that both have faults, that we have to agree. We have to be honest. And what are the correctable things, that also we have to decide and discuss and to see whether it can be corrected. Now let's discuss about the regulation and rules of starting a hospital. Many of you will not know about this. I myself did not know much about this before I started a hospital around maybe 12 years back. This Mangalore Institute of Oncology at Pampel in Mangalore, which is a specialty exclusive cancer hospital. We started it in 2010, now say 15 years. At that time, regulations were minimal. So it was not difficult to start a hospital. Now, when I'm seeing 15 years down the line, there are so much regulations. So rules should not hurt the right people. So you do rules to correct things, not to damage which are good. So intention may be honest. Now there are so many things we have to comply with. It's like I'll give an example. Like there is what you call NABH, where they in the NABH manual only they call patient a client or a customer. So that is the kind of rules we are following, NABH. Then there is fire safety, biomedical waste, digital tracking, software. So much of difficulty in running a hospital means cost overruns. Difficulty means done with good intention, but I will give an example. Suppose I am there is a small person. He is having a boat and he is going in the river. He gives around 5 6 people, maybe they are in his boat. He is taking them from one side to the other. He gives life jacket to everybody, and he paddles the boat and he goes across. He was living happily like that. Somewhere at some point of time, one of the boatmen, there may be 10 boats, 1 or 2 persons did not give life jacket. Some tragedy happens. So what the person who is regulatory, in this case the government, what they will do, they will tell, oh no, somebody, this tragedy has happened, so we have to bring rules so that all should follow. So this is a small boat. Similarly, there is another big ship in the ocean. So the ship in the ocean requires a lot of safety mechanisms, because there are a lot of waves. It is a dangerous zone. So it is very difficult to manage such a big ship. Sometimes 5,000 people will be there in that ship. So there are many rules that. So what the government does, says that either you follow all the rules of the ship for this boat, or you go to the ocean. Means you have to take this boat and go to the ocean. Basically, what is the choice before this small boat person? He will drown. So basically, you are killing a person who is doing his duty honestly with minimal cost and actually is doing a good job of taking a person from one side of the river to the other side. If you put this life-saving jacket, nothing will happen. So you're doing that kind of things. So now we have so many regulatory things that it is very difficult to run a hospital. So you have rules and regulations for everything. I'll give an example. Actually, for fire, up to 21 meters, there is no requirement for fire. Above that, I think they say high-rise building. It's a government rule. But if you have a clinic, something in between, in the first floor, you have to have fire safety. All the fire safety rules applies to you. Down there is a cloth shop. For him, there is no fire safety. Up there is a computer data enter where 100 people work. For them, there is no this fire safety because the building doesn't require. But you are doing a medical profession there, you are asked to do this fire thing because you have to spend around 30 lakhs for that. So what you will do? You will shut down. So you are doing some service. So instead of spending 30 lakhs and inviting trouble, an honest and ethical person will shut down. But a big player, what he can do, suppose he has all the resources. His turnover is at 2000 crores. And my turnover or the small fellow's turnover may be 1 crore. The person with 1000 crore turnover, he can get this done all very easily because he has administrators, he has lawyers, he has CEO, he has so many people. They are done. They are appointed for this only to manage the rules of the government. I'm not telling rules are bad, but you have to think before you apply and where you are applying. So basically, there's a big team to run the hospital apart from doctors. So in our hospital, we are small hospitals. Like we don't have very big hospital. We feel that a bigger the hospital, the quality becomes poor and affordability becomes difficult, accessibility becomes difficult. That's why we have started one in Udupi to help the people there. Otherwise, they would have come to Mangalore. Now we have started in Tirthalli. All those people were coming to Mangalore anyway, so we wanted to help them. And it's a small, efficient center with only 50 staff. But you can't apply a rule for me what you are applying for a 5,000 crore hospital. So it becomes very uneven and unfair. And the 5,000 crore person will not close because he has enough revenue. It's in public money invested. So he will not bother. What I will do, I will shut down. So I feel there's no point because personally it will not affect me in any way, having 1 or 3 hospitals. So it doesn't matter for me. But generally, public have to think, people have to think, policymakers have to think. So this will be a serious issue in future because sometimes we attach price tag to health. It doesn't work that way. So it doesn't mean that you pay 1 lakh, you'll get outcome is better than you pay 10,000. Unfortunately, in health, a lot of other things count. I will give you one statistics. We better learn to accept it in the medical profession also. In America, after heart and cancer, first cancer, second heart, the third most common cause for death is iatrogenic. That is called medical errors, not negligence, errors. So training is very important. So you have to have very good trained doctors. So this is all very important. So finally, we are actually losing good doctors, not because they are failed medically, because they are unable to survive in this atmosphere. So they will be slowly out of the system. So it's not a problem with the some of the doctors who are very good, but our system will not allow you to survive. So then what happens? You see, I'm a dignified person. If you are ethical, dignified, what the best option is? You tell, I'll get away from this. Let others handle this kind of things. I can't do this. So this is what is happening. So you will lose more and more good people who are trying to do good. So those who can manage the system, do all kinds of things, appoint lawyer, they will be people who will survive. And of course, the government hospitals will survive. So this is the thing which we have to face. This is a reality. Okay, now let us see what the data tells us. We'll return back to data because that is the hard facts. So now I have an experience running a Tirthalli, a cancer hospital. MIO has done it in Tirthalli. So we are running the hospital at 500 rupees a bed. Everything is actually reasonable and economical there. So it is possible. At the same time, if you want the same treatment in a big hospital in a city, corporate hospital, you have to spend 6 to 10,000 per day. Government spends 4,000 rupees per day, anywhere between 2,500 to 4,000 rupees. Still there is a problem with the government. There's some efficiency issue, fatigue, overcrowding, and sometimes misuse also. So I'll tell you two examples. Two patients came. This is apart from the private hospitals. I told you will charge 6 to 10,000. I'm telling you example of government hospital. When it's free, what happens? Because everything that is free is not good unless the outcome is good. Giving free has no returns at all. So one patient was there. He had CA tongue. He's from North Karnataka. So we treated him with the chemo radiation based tongue. So the treatment is chemotherapy and radiation given together. So I did it. Then I told him to come after 1 month. Generally, we see whether they have some infection, all that to see. Immediately after radiation, sometimes they can get complications. So I told him, you come after 1 month. He came after 1 month. He did a CT scan of his face, neck, chest, plain, contrast. He came with 4 CT scan reports. It's just 1 month after radiation. I told him, did I advise you to do this? No, sir, I have done it because I just wanted to see. You gave radiation last month. I want to see how it is. So generally, actually, we don't do anything for 3 months. We are just seeing the toxicity profile. We are trying to recover him. There is no use of doing CT scan after 1 month after radiation because I have done it just a month back to give the treatment. Why did he do it? Because it is in the government hospital. It's free. He did chest, neck, everything. So in a private setup, it would cost 10,000. So it costs the government something, 6 or 7,000, which the government pays the CT scan, all these things. So it is a waste of money, resources. He got it done on his own. Maybe he asked somebody to call, or I don't know how he got it done. There was one more example. There's one more patient with CA esophagus. Esophagus is food pipe, which connects the pharynx to the stomach. So the lady had CA esophagus. So I told her, you do CT scan about neck, chest, and liver. I do CT scan. I said, if you don't have money, you get it done in government hospital because now government hospital also CT scans are there. So what she did is she went for CT scan. We do it in 15 minutes from neck to chest. Takes us 15 minutes to do, and report comes next day. She went to the government hospital. First, she went for neck plain, then contrast, then chest plain contrast. Then I asked for liver, abdomen, pelvis, everything they did, chest plain and contrast. And 2 times when she go, machine was out of order or some problem. So the patient had to travel 45 kilometers, went 8 times, and got 6 CT scan reports, which we would have done in 15 minutes, and it is one shot to be done. So this is another way of difficulty, efficiency. Now in cancer, if you wait for 2 months to do a CT scan and ask the patient to come 8 times, it's a serious issue. Actually, the stage will go from stage 1, it becomes stage 2 or 3. Till it is like the patient will die. So these are the faults which we see. So efficiency must be there. Same thing, if I do it in 15 minutes, I can't charge 10,000 rupees. I'll be excluding him because he may not have money. So we do that scan for 4,250. It is maybe less than what the government is paying whoever is doing the scans. So our scan cost is less than what government is doing. 4,250 for neck, chest and liver with contrast. So the problem is this inefficiency who will tackle? It has to be a serious issue which has to be tackled. Otherwise it's waste. And one more thing we focus is on rules, that is on input. Like we say, India has 1.4 billion population. So we need this many doctors. So say for 10,000, this many doctors, WHO says. Then we start producing doctors. We are not bothered about quality. Like a photostat machine, you just keep on. We need how many? 10,000. Open everywhere medical college, do 10,000 doctors in next 5 years. The government and many people think that it will not affect them. They feel that they will go to good hospitals and take treatment, and these doctors India needs. They should remember that the same doctors will work in every hospital in India. And if you produce low quality doctors, you will also suffer. You will also be the victim for poor quality healthcare. So this is what happens in our country. So you want something, produce. Forget about the quality. Outcome, you don't bother. Input. How many doctors are required? 10,000. Produce 10,000. Whether they are good, who will see? We are not bothered. Like dental profession. Already we have destroyed it. It's gone and dead. So unless you have a father who is dentist or and have a clinic, they're doing dentist is so much frustrating for the dentist now. So input is, we focus on input. In hospital, we see how many MBBS we want, you produce. Then you see what is the size of an ultrasound room. You are interested in that, whether it is 20 by 20, whether there is a handicap toilet. All this you see. NABH accreditation do you have? The YSFT all input you see. You are least bothered on how many patients are coming out alive. So you are not seeing outcome. So it should be based on outcome. How many patients are satisfied in your hospital and how many patients get cured. That is the only thing. Whether you have all this room, big room, whether you have this much temperature, if you have infection and death, so many infection and death, there's something wrong in the other part of your handling. It's nothing to do with your input rules. So now we are focusing more and more on input based regulation, not output based assessment. Everywhere it should be what is the outcome. You put 1 rupee, you should see what you are getting out of it, how much health you are getting, or what is the outcome. So if hospital like ours, we are doing at 25% of the cost of the government. 4x we can say, government charges 4x more than us. Big corporate hospital charges 12x than us. So still I can assure you that our results will be better or equal to anybody in anywhere in the world. This much I can be sure of the cancers that we treat. So we can do it actually, but we have to be really focused on outcome, not on what is the rules that we are following. That is not important actually to a great extent. There is compliance is important, like you say fire. Certain things are important, required, but you can't have one fit rule for everybody. I'll do everything for everybody, same rule. So that is the problem, and at that time, good players will slowly get out of the system. So finally, let us decide what is the way forward, and let us discuss it. So now we have agreed that there is both problems in the private sector plus the government sector. One is to be ethical, non-exploitative for private sector. For government, should be efficient and avoid wasteful expenditure. So outcome is important. So the way forward is that both are required. We need government, but we need private hospitals also. So we should focus on rules and regulations which are supporting ethical hospitals. You have to have a audit metrics should be as per outcome, not as per input, what building you have, what size of the room you have. That has no role in patient care at all. So you should see how many patients are cured, what is the success, what is the patient satisfaction. All can be done by independent agencies by through artificial intelligence. So outcome based regulations are very important, and you can't have one fit rule for all, like 50 bed hospital same rule, 1000 bed hospital same rule. In a rural hospital you have to follow the same rules. In Bombay also you have to follow same. It's not possible. Like sometimes the central government or a Supreme Court judge, he will pass a rule saying that this applies to whole of India. It's not that easy. I feel that the judiciary or the judge, he should come and visit a hospital, sit in a rural hospital, see for himself how it is run. So there's a reality, no? So it's whatever judiciary passes should be for the good of the people. So you have to have first-hand information and sit and see. You will know how things are. Then you will be more realistic. So that is more important. So when you start a grading as per ethics, ethical and cost-effective hospital should be graded in a different way, and then you can encourage more and more good people to be in this healthcare, so that the people who are non-ethical, exploitative, wasteful expenditure, inefficient should exit. They have to change themselves and be good, or they have to go out of the system. There's no other path for this. So if you are an ethical hospital and running in a hospital in a rural area, actually you are taking health care or like cancer, very advanced tertiary care to a rural place. So they have to give you tax breaks. So for example, I have paid for a CT scan machine in MIO, the hospital has paid 40 lakhs GST, central and state. How can you pay in Tirthalli 40 lakhs GST? Our power bill is 19 rupees per unit. So land, everything government should help for small hospitals which are willing to go to rural areas. Because sometimes I see in paper this hospital chain has 10,000 beds. What you are talking? India's population is 1.4 billion. What will you do with 10,000 beds? It will not touch anybody. It hardly makes a difference to a country like India. So the mega big hospitals who are talking that I'm having 10,000 beds, 15,000 beds, they are not going to take care of the health of India at all. Ultimately, the health of India is taken care by small hospitals which are ethical and honest and run with the minimal profit. In rural area like 10, 20 villages should have one hospital. So only then we'll have thousands and thousands small hospital. Sometimes government spends 2000 crores on building cancer hospital somewhere in the capital of some state. I've read about it somewhere in Rajasthan or something. What can you do with 2000 crores one hospital in the capital of the state? You expect the whole cancer patients to go there and sleep on corridors? So that's not the way to waste money. So the future of this health system is to encourage ethical players in the private sectors. We should have good intention, and we should make some profit also. When you are in private, you have to pay bank loan and all. Nothing comes free. Even for the government, as I told you, they spend 4,000 rupees on a bed in a tertiary care center in the government setup. So you have to encourage ethical players. You have to give tax breaks. All this you have to encourage so that India will be a healthy nation, and the future of our health will be in good people who will take care of the country's health. Otherwise, we are in for a disaster. This is a very interesting, I know it's a little bit difficult topic, or what we can say tough topic, but I feel that if you have been listening to me till the end of this show, I want you to maybe share this podcast, like it, give your comments. If not anything, you speak about it with others, and especially policymakers and people's representatives. All these people should think very seriously about this. Never think that you will be out of this trouble. Someday it will come and bite you. Thank you all, and I wish you good health until we come again with a better and more tough topic. Thank you.